I loved the aspects of teaching, nursing, all those things, and I felt like speech-language pathology kind of combines all of those different elements together. And I love to watch my kids make progress and feel like I'm making a difference in their lives.
I really enjoyed the one-on-one interaction with my patients. I really enjoyed being able to see that continuity of care. I really enjoyed being able to make that connection with them and help me to really feel like I'm making a difference in their lives.
Being in their home with their family, giving strategies, modeling, providing education, we are the ones providing the most impact to these kids because we're seeing them the most. And it's such a special thing to be invited into somebody's house and for them to trust you and to build that relationship with their kid is really cool.
I just felt like I was more needed in the home. You have special needs children, parents mom wants to work. It makes a difference to the moms just to go run and get your hair done, get your nails done.
When it comes to physical therapy, it's all about gross motor function. It's like finding the ability to move. Like another term for physical therapy is a doctor of movement. We're all about trying to find the best way to move your body, the easiest way to move your body, and the best way to sort of move about your environment. And with special needs kids, it's even more important because you literally need to teach them. And so I remember the first time I taught a patient how to walk, they were ground mobility only. They had no ambulatory skills whatsoever because they had a heart condition that made them extremely weak. And through months of building up their core strength, building up their proximal leg strength, and mostly confidence too, gradually building through dynamic balance, I was able to teach them within 6 months how to walk. And I still see him to this day, and we go on community walking all around his apartment complex, and that used to be just one spot on his couch. So I mean, there's just nothing better than that. And I've taught 5 kids how to walk so far, and it's you never forget those. I know each one of them. I know where I was, when I was, the videos I got. It's the best.
I think the biggest impacts we see in this setting is when you see something carried over outside of your sessions. We've been working on some independence in daily living situations and starting to see their independence with that and working towards that independence to be able to do that in their adult life and not rely on caregivers.
And I think so often kiddos sometimes have a really hard time processing exactly what they want and what they need. And so the more we can develop skills toward that end, where they can be not only physically independent, but also more emotionally and socially independent, those are pretty powerful goals to see materialize.
Some of these kids, it takes a while for them to make that progress. It's really fun to just see those little things where it's they're told, oh, you're not going to be able to do this, and now they're actually able to successfully do it and achieve those big milestones.
I have a client who's bilingual, and I wasn't seeing much of a change, but when I met with the family for the quarterly progress report, the mom was like, she's doing so much better ever since you started working with her. She's talking more. And I almost cried because in session, I was like, I feel like I'm not doing anything. I feel like we're not making any progress. But then to see it generalized when I'm not there, which is totally fine, but to see it generalized during time with the family or at school, that's when I feel like I'm actually making a difference, because it doesn't matter if I see it. It matters what the family sees, what the siblings see, what the world is seeing. And so whenever I get remarks like that from families, I think that's when I feel like I'm making the biggest difference.
It's not so much about the title. It's about being in the present and taking care of whoever you're taking care of. In the home, you form a special bond. And I think that really is unbreakable.
I will say the flexibility of this job is amazing, but beyond that, there's something so incredible about working with the patient and their family. You're just going to see better results, and you're going to see more progress. And I really feel like I'm a part of these families. I don't ever dread going to work. I love going to work because I love seeing my patients and I love seeing their families. So I've never looked back, and it's just an amazing job.